Welcome to The Right Chamber.
The podcast where we dive deep into the fascinating world of medicine and healthcare.
In every episode, we will talk about pivotal topics relating to medicine and surgery in the UK and what it's like to be a healthcare professional today. We are inviting doctors and other healthcare professionals across different specialties to discuss their experiences and give an insight into what their journey has been like. Please follow us on Instagram and TikTok at RGUCMS and subscribe to our YouTube channel, RGUC Media. So sit back, ignore the traffic, and enjoy the Right Chamber podcast. Dr. Elizabeth Rees, originally from Birmingham, earned her degree from the University of Birmingham and completed microbiology and virology training in the West Midlands. She has worked at Russell's Hall Hospital for 25 years. Married to Owain, she has 3 adult children. Her eldest, a trainee in elderly care medicine at Russell's Hall, recently welcomed a baby girl, Elizabeth's first grandchild. Hello, everybody. Welcome to the Right Chamber podcast. We have got a special guest here today, and we've got some interesting topics to talk about. As always, it is me, Victor, and my colleague here, Jaspreet. And for our special guest, we'll let her introduce herself. So just tell us your name and what you do. We'll start with that.
So I'm Elizabeth Rees, but please call me Liz. And I'm one of the microbiologists here at Dudley Group. I'm employed actually by Royal Wolverhampton as part of Black Country Pathology Services. I'm the infection control doctor for the trust as well, and also Chief of Community and Core Clinical Services Division.
Brilliant. And how long have you been working with the Dudley Group?
No, I'm quite happy to say, but it's an embarrassingly long time. I've been here 26 years. Yeah, it's a long time. I came here as a consultant in November 1999.
Wow.
Obviously straight from school. But I did my degree in Birmingham.
Okay.
Yeah, so I was born and bred in Birmingham. My husband thinks I have an elastic band attached to the middle of the city that only enables me to travel so far out of it. So I did my degree in Birmingham, and then I did all my specialist training in the West Midlands Deanery. And then my husband's a dentist, and he had bought into a dental practice locally following the death actually of the senior partner. So it was an opportunity. So we decided to stay in the area. So then, unlike some of the people I think you've interviewed before, I hadn't ever worked here as a junior at all. But yeah, I came in 1999. I've been here ever since.
Wow, amazing.
So you're the microbiology consultant for
Dudley.
So how did you feel during the most important time of your career, COVID?
Yeah, it was challenging and interesting, if that makes sense. And I can remember the day we had our first patient. So obviously, if you recall, the end of sort of 2019, there were cases in other parts of the world. We've had over the years a variety of things like SARS and stuff like that. And people had started to ask me if I was worried. And I think we were all worried about what would happen. And we had the first case here the beginning of March, so before the lockdown started. And it was on a Sunday. I can remember it. I got a phone call on the sort of Sunday late morning to say, and it was a patient who'd actually already been here a couple of weeks, which was not what we would have expected. They'd come in with something, appeared to have come in with something else. And to be fair, it's one of the cardiologists who said, actually, could this be COVID? And that began, so that day, there was a meeting later that day with the execs what is now the UKHSO, so Public Health England, the Acute Trust, about how we would manage this case, because they were popping up. Wolverhampton had had about 2 cases a few days before. And then more cases started coming. And the challenges initially were a couple. The first was access to testing. So samples could only be tested at Heartlands. It's the regional virus lab. And so there was a delay, obviously, in collecting samples, getting them transported to Birmingham, and the volume that they were seeing meant that they were running them as quickly as they could, but there was a bit of a lag. The results were coming back through a portal, but they weren't going directly into the patient results. So every morning we were having to download all the results, manually enter them into the patient's file, and I would sit in the morning just going through, because to let the wards know that they got a case, we were phoning them. And what was really quite, I suppose, difficult really, is you'd have this list of maybe 20, 30 patients, and half of them would already have died.
Wow.
And that was the most striking thing. And then the other issue was around access to PPE, and also what should you use?
Yeah.
Because nobody really understood how it was transmitted. So it was like a best guess to start with, which is why, to start with, you remember it was just these surgical masks rather than the FFP3s. And I can remember, and don't laugh, I can remember one weekend, it was obviously before the lockdown, because I was in a salon having my eyelashes done. I'll fess up. And I got a phone call from the hospital to say that they'd run out of surgical masks, and did I know where we could get any? I mean, literally hospitals were going to be in queue and things.
Wow.
And the girl who was doing my lashes, because I said, I'll come in and we'll sort something out, don't worry. And bless her, she said, do you need masks? And I said, well, yeah, you know, because everybody in the country knew. And she gave me, because, you know, in a lot of those, like, because they did nails as well, they all wear surgical masks. She gave me all her boxes of surgical masks to bring to the hospital, because she decided hospital's need was greater than hers.
I mean, they were nice.
Yeah, she was such a sweetheart. They were, I mean, the week later everyone was closed down, but it sounds like she wouldn't accept any money for them. She just, and people were lovely. That's the other thing that became apparent, is people were really willing to help if they possibly could. So then the country went into lockdown, and I think that was it's a surprise to you personally as well as in relation to the job. And the trust, we set up a group of us who met every day, because, as you pointed out, the advice changed every single day.
Yeah.
About, it wasn't just the PPE, but also how you manage patients. We had challenges about distributing oxygen through the hospital, because you don't normally have that many people requiring supplementary oxygen. To be fair, our estates department were brilliant, and I think we were one of the first that basically set up a system whereby we could measure the usage, and if it got to the point where you couldn't release oxygen for a certain location, we dropped it across the board, because obviously you could afford to drop it a little bit. And you might remember we accepted PO2s much lower than you would normally accept. So they were titrating the oxygen, and we also had to do some engineering work, because we had a massive cylinder, but actually getting the supply, because of the relation flow and pipe diameter. So they did some engineering to enable us to get oxygen both into the wards in its sufficient volume, as well as, obviously, we closed theatres, so we had patients in theatres being ventilated, patients in ITU being ventilated. patients on wards on NIV. The COVID inquiry will have a look at the fact that we discharged. I mean, it's the only time I can remember where we had empty beds in the hospital, because we were asked to empty our hospitals. And there's obviously a question now about sending patients out with COVID back into nursing homes. It'll be interesting to see what they decide, but we were asked to empty the hospitals. There wasn't access to testing unless you were symptomatic at that point. And the inquiry will have to determine what they think about that. Then more advice came out about wearing FFP3 masks and some of the other advice about what people should be wearing. And trusts were allocated a certain amount of FFP3, well, all the PPE actually, because it was in limited supply. We had an arrangement with a neighbouring trust who didn't require so much, the mental health trust, to have some. They shared some of their supply with us to enable us to have more supply to offer staff. And so we followed the national guidance. In fact, we probably moved to FFP3s a little bit in advance in more areas than the guidance suggested. But I think the other part of all of that was people were frightened to come to work. I can remember, because I think for the first, it's about 24, 25 days, I was in every day. And you're meeting a lot of people who are terrified, actually. And you can understand why when you looked at the
Statistics
impact,
and everything.
the impact of this disease. I had colleagues who would be sitting in ED, seeing, I can remember one of my colleagues phoning me up afterwards just to have a chat, and she'd seen 3 men about the same age as her husband in ED, and she was having to phone, because she couldn't bring family in, phone their relatives to discuss their likelihood of surviving or not and what was needed. And you couldn't do it face to face, and how difficult that was. And it was also very close to home because of, they were the same age as her husband. And some people had very little in the way of pre-morbid illness. They weren't all high risk. And it was interesting at home as well, because my husband's a dentist and they were stopped from working. And I have 3 children. My daughter was on her FY3 year. She was in South America, managed to get a last flight out home. And I can remember she came back home and isolated with us in Birmingham. She's at university in Sheffield. And I can remember selfishly saying to Fan, you don't need to work. You can stay at home and be safe.
Oh.
And she said she couldn't do that, and she went back up to Sheffield and worked on a COVID ward through the rest of the till her FY3 year finished, and then she rotated. Actually, she came back down here to do her specialist training. My youngest son was a student at Exeter doing engineering, so he stayed down there because when they eventually enabled a little bit of face-to-face because of doing an engineering degree, they were one of the core subjects that were allowed to go back in. And then my middle son, who had applied to Sandhurst and was waiting, was working in Costa part-time, got furloughed from Costa. So he was employed here on the bank, and he did the data for us. He came together with another young person, because we had to send so much data centrally about our COVID numbers. And, I've described the fact that it was coming through a portal. It wasn't going onto the so we were having to manually load it onto the laboratory information system and then into the results. But every day we had to send data about how many beds we got, how many COVID patients we got. So my son was helping in the department to provide the data to the incident room here. And my husband found this horribly difficult because he was at home. But to be fair to him, he kept me going because I was here all the time and I'd literally go home. He would be queuing outside Sainsbury's for food because if you remember, I don't know how I would have eaten actually, to be fair. So I think it affected work life as well as feeling the impact of it. My mother was very elderly and infirm and lived on her own, so we included her in the bubble when my husband decided that she wasn't going to die. I mean, he literally said, I will keep your mother alive through this if I, and mainly by making sure that she didn't have to go out. So he would take her food, help to look after her because she was early stages of dementia at the time, but still at home.
It would have been terrifying coming from work back home as well, because it'll be playing at the back of.
I think that was the biggest fear.
Yeah, I think what you have to do is, and I think everyone had a wobble, and you've just got to have a chat. Well, what I did, you've just got to have a chat with yourself about the fact that you this is what you're doing, and you will be sensible and you will take the precautions that are required and you'll get on with it. Some people, there were people who couldn't, who found it even more, well, it's how people deal, don't they, with stress and anxiety and that. And for some people, I think it was more difficult than others, and some people had reason why that might be the case. They've got particularly vulnerable people, vulnerable members of the family at home. But I don't think there was anybody that it didn't affect in the way of anxiety and nervousness about attending work, because when you start these jobs, you know that they're going to be, unsocial hours, emotionally challenging at times, physically demanding. I don't think you ever expect that you're going to be in fear of your life attending work, and I think that was the bit that I think people found most challenging to come to terms with. And I mean, presumably, I've no idea how, because it made me think about people actually in the armed forces who are sent out. They must deal with that as part of their job, but it's not something
police, firefighters.
Yeah,
but you don't think doctor.
No, you don't. I just it was, and it was everybody in the building. So it was the nursing staff, admin and clerical staff, the cleaning staff, the porters. Everybody was potentially at risk working in this environment. I mean, I think people came to terms with the fact that actually, once they allowed a certain amount of contact outside, that you were potentially at risk in your own, as it were, outside of work. It just felt much more concentrated. Well, it was much more concentrated coming into work.
So much has been impacted as you've laid out there. Do you think, as a whole, do you think we were prepared for what was coming?
No, I mean, all the modelling had been done based on a flu pandemic, based on the fact that the pandemics that they'd looked at had largely been flu. And obviously, I think the thing that was striking about COVID was fundamentally the mortality associated with it. So people don't always appreciate how the mortality associated with flu, but it's not anything like this turned out to be. There was no preparation for the respiratory support required. I mean, we got we got sent ventilators from I don't know where, and our medical engineer had to strip them down and rebuild them because they were just not fit for purpose. So there was no preparation for that. There was inadequate supplies of PPE, I think, as we all found out. So no, we weren't prepared. The first bit of the COVID review has reported, actually, and already I went to a tabletop exercise about a month ago for the Black Country, and it was actually over the whole region, but they had Black Country trusts and they were modelling more scenarios. So a flu-based thing, a COVID-like infection. So I think what the ask is that there is more modelling taking into account a broader range of disease. Whether that actually leads to anything different is difficult because I've as we've discussed, I've been doing this a long time, and when you're asking trusts to put aside equipment that's probably got a use-by date on it that they may not use in the next 5 years, that's not how the NHS really works, because there's a cost associated with putting aside a whole pile of ventilators. Do you see what I mean? I'm not sure how, and I think that somebody centrally needs to either have a mechanism for switching on production, because no one's going to store. I don't think people will store things for long periods of time.
But you never know when you'll need.
No.
People stored toilet paper though.
Yes.
You never know when you'll need the ventilator, so you can't just keep piles of ventilator.
No, it's. I think it's actually very difficult. So I think there should be some modelling, and we should be prepared. But I think we have to recognise the challenges. And for example, for this disease, at the time, nobody knew what drugs, if any, would work. There was no vaccine. I mean, I think one of the things that is amazing that came out of this was the speed of vaccine development, actually. And I know there's different, if you look at some of the research, but certainly my view and the majority of my colleagues' views, vaccine transformed the cases after it was introduced. And I also think it altered staff's perception of their own risk. Just, once something was being offered to help protect you, I think that made a difference to how people felt about working in the environment.
I think a lot of people were scared initially, and then when they were there's a little bit of safety. If I do catch it, it's not going to be as bad as without a vaccine.
Yeah.
I do remember a lot of staff was apprehensive about taking the vaccine.
Yeah.
But yeah, I think that was challenging as well. I think
it was, because it was partly, I think, because of how quickly it had been created, and partly because of the technology used.
Yeah.
And I suppose in a way there's a little bit of an act of faith, isn't there? But I think because you were balancing risk against this potential benefit.
And there's also the war of false information or misinformation at the same time.
that was
It just complicates it.
Yeah, I can remember speaking to somebody who was saying, well, of course, when they, shouldn't have really administer vaccine, they're sort of tagging you as well. I was like, I don't think so. But people had
so much paranoia about it.
Yeah, and that's very difficult to overcome, isn't it? I think in a hospital setting or any healthcare setting, you might be able. You've got mechanisms for speaking to, say, the workforce, but out in the community, and there were certain areas and certain parts of the community that had real challenges with getting acceptance of vaccine, and some of those people were the highest risk.
Yeah.
And there are probably some lessons to be learnt then, or just trying to overcome those sort of challenges. But I think that was really difficult as well. And of course, what it's left us with is, so we've learnt lots of things, and we've got some new vaccines, new technology. What that's left the NHS with is a workforce that's 20% bigger than it was in 2000. But we're not doing any more work. It's interesting, isn't it? So all the challenges that we're facing in the NHS at the moment are, plus all the backlog of work that it created because we stopped doing so much. And I think one of the things they'll be looking at is the decision, some of the lockdown decisions, and the impact, the risks versus the benefits, the impact that had on society.
Because right after COVID cases started going down, we started having patients coming with depression, alcohol problems.
Yeah.
Because
one of the things that I found quite difficult was the concern, and I think the absolute increase in sort of domestic abuse, because people were locked in their own homes with no ability to access help because of the lockdown. And I think there was I think those sort of things that's what needs to be taken into account, is the impact, and the impact on some children's education.
the COVID generation.
Even I was one of the COVID doctors graduates, you know, the OSCEs were not traditional when I graduated. Half of my OSCEs were online rather than in person. So imagine, all the other sectors as well that would have been affected in terms of education. Yeah.
And I think probably social interaction as well for children, because I think it must, it's personally, like I said, if I look at my facts, so it delayed my middle son's application to Sandhurst, which actually I think probably worked out better for him, because he actually decided to go back to university and do another degree, which I think is the right thing for him, probably, rather than what he thought he was going to do because of the delay. And obviously my daughter didn't get to have her trip round. But I think compared to some people, we got away fairly lightly at. The only thing is, completely contrary to that, my husband lost his mother to COVID in a hospital. She had a stroke and was admitted to hospital, and there were issues in getting her discharged, and during that time she picked up COVID. And those are the sort of things that were happening to everyone.
Yeah.
So it was a very difficult time, and who knows when anything will happen again.
I think it was quite challenging for staff when the public was saying that it doesn't exist either. And we're like, we're going to work facing this.
Yeah, it is real.
It is real.
It
was like, no, it does. It's
I
not
suppose
real.
the question now then is, from everything that's happened, everything that we've learnt, and the things have changed, both in terms of our behaviour and also things in the systems. Are we in a better position now
To deal
with
with
all that knowledge to deal with
another pandemic?
something else like that?
So I suppose we probably understand that something awful can happen, because the last pandemic was like 1914. Nobody could remember that. I think there will be a real attempt to learn from what's happened, and that might help inform decision making going forwards, which I think is probably a good thing. I think what I don't know, and what potentially is interesting, is if somebody, because it's an international disease, the world's small. The reason it travelled so quickly was because of international travel. I think there are some countries looking at their COVID response and what they did, and I think there are others that not. But whether there's going to be any sort of international view. So we need to work out. We've got a national health service, so our response would be national. Different countries have got different healthcare systems, but if you look back, largely what most of certainly Europe did was what we did. They had lockdowns, and it's whether I'm curious as to whether there would be any discussion across maybe Northern Europe about if there was something else again. So we're talking about our national response, but what about the international response? I mean, Australia shut its borders, didn't it? So I don't know what, if anything, will happen about that. But certainly we should learn something. But I think we have to understand the limits of what you can prepare for, to be honest. But the big thing that for me, having said all of that, was the willingness and flexibility of the workforce to rise to the challenge, because they did, and the amount, in a way, of goodwill as well from sort of society towards healthcare staff. I think every day there were deliveries of food into the hospital from once they were allowed to be open. Was amazing, actually, and I think in some ways it brought out the best in people.
Yeah, I think even people during lockdown, they were at home. I think it brought families a little bit closer as well, because you had to spend time with each other.
Yes.
It brought everybody together, didn't it?
Yeah.
It did, yeah.
Even at work, because wards were closed, people were not operating with it. You were, I would say, forced to go and mingle with other departments. So I think a lot of friendships were, made from that as well. And people started respecting each other's contributions as well.
It's something about everyone being in this collective stress together and being able to just manage it together and smile at each other. Well, we're under masks because it's
Pfizer and everything with the names
but
written
to be able
on.
to just cheer each other on, and also seeing the response from the population as well to the NHS during that time was quite amazing to see.
It was
and feeling
amazing,
appreciated for
Yeah.
everything that you're doing.
Yeah.
So yeah, I think that's a big takeaway from it, is that people can rise up to the challenge, and we've seen that from the response.
No, absolutely, and that's probably the most important thing to me, was the fact that that's what people were prepared to do, and largely without complaint. To be honest, I think people were exhausted by the end, though I think it took its toll. But people wanted to help, didn't they? So given the adversity they were working on, I think that's amazing, to be frank. But but hopefully we won't have another one.
Hopefully, fingers crossed.
I mean, it's devastating, actually, wasn't it?
Yeah.
But I feel like it was like a decade ago.
It feels so long ago now, doesn't it?
It's a bit surreal, actually, isn't it?
Like, did this happen? We're all in the house for like over a year, 2 years, just together. Like,
yeah, no, it was a very strange time. Actually, a very strange time.
Especially with like NHS stuff. I know like everyone was like locked up. It was nice to go to work because it was an escape as well.
Yeah. No, I mean, I'm talking amongst my colleagues, a lot of them actually feel grateful for having a purpose.
Yeah.
That they felt that and it maintained their lives and their routine, being able to attend work. And I think that for some people it must have been extraordinarily difficult.
Yeah.
And if your home circumstances aren't great, being locked in must have
stuck
been
in there.
very, very
Exaggerates
difficult.
everything that's going on at home.
Yeah. So, in many ways, I was pleased to be able actually to come to work. But going back to what we said before, I can remember just having to have a little chat with myself, because you walk in and you think, what am I doing?
Yeah.
Yeah. But no, it well, hopefully it's something that won't happen again in my lifetime. But we do need to learn from it, and it will be interesting to see when the different strands of that COVID inquiry report what it suggests we do.
That would be, yeah.
Because I've still got that bit to do.
Really had a very good conversation, I think, really diving deep into the impacts that COVID has had, the kind of how it all played out in terms of our response, and also kind of looking into the future, or how have we changed since then, but then also looking at the positives of what came out of it. I think these are all really important things, and
your personal experience.
Because being microbiology consultant, lead of infection control during a national,
having to figure things out.
Really, kudos to you. Congratulations for
great job.
for playing all of that. So.
People always say it was a team, but it was actually there were a group of us, and it included clinicians, pharmacists, estates department. Everybody contributed to trying to manage the impact of this as best we could.
That's amazing. So it really shows that heart of teamwork as well, isn't it? Because
it's not something anyone could do on their own. Absolutely not at all.
I'm sure everyone listening has been, following and have taken something away from this. This, I think, sparks lots of good conversations, and I'll certainly talk more about this, and a lot of reflection, I think, is to be had. So thank you so much again, Dr. Liz, for coming on the Right Chamber podcast. It's been lovely, and we will end it there. Remember to stay connected with us on social media. Follow us on Instagram and TikTok at RGUCMS, and subscribe to our YouTube channel, RGUC Media, for more exclusive content and updates. Thanks for tuning in to the Right Chamber podcast. Until next time.